So, first of all, um, we need better ways of finding our patients. It's hard to identify and to accurately count rare disease patients. Only about 25% have a specific ICD code, and then only about 50% can be mapped to a more general code that makes it possible to find people in healthcare systems. So that leaves a whole lot of diseases that it's even hard to find. And if you can't count rare disease patients don't count. So we think, if anything, our study was probably an underestimate, not an overestimate of what the costs are. And that we need more research and more disease modifying therapies. Obviously, this was a very small sample, but in the few patients that we did look for, having a disease modifying treatment does seem to make a difference to people's lives. And then for one of the other questions we were trying to answer, would it be possible to develop some kind of machine learning that could assist with diagnosis? So we think the answer is yes. So again, you don't have to hit on the exact disease, but if we look at some of these characteristics, we think you could probably do general queries of databases that would help us to identify possible rare disease patients who could then be escalated quicker. So young age, high utilizers, um, specialty care, an ICU or more than one ICU admission. I mean, these are all things that are pretty unusual, thankfully, in children. So, we might be able to leverage that to hone in on its diagnosis sooner. And again, in a very small sample, it looks like earlier diagnosis and appropriate treatment could make a substantial difference in the course of disease in some cases, not everything, but in some cases. Getting more ICD codes has certainly been something that a lot of groups have been working on, and something that has been getting some attention. And if we had that, that would make a lot easier. Um, and the more of these diseases, especially the unknown and established diseases, that would be very beneficial. But right now, we're identifying about 200, 250 new rare single gene disorders a year. So the system is never completely going to keep up with that. So some of these other techniques, some of the things that we just preliminarily looked at. So you take some diagnostic criteria, and can you pair it then with something more specific, a specific treatment, a specific test, something to try to build a picture that you could then apply to the medical record. So that can be done and has been done, but the problem is scaling it again. We don't want to have to do this times 7,000. So are there other ways to machine learn and to machine read? So the answer is probably yes, and increasingly more frequently becoming yes, but not to do it just for one disease, but for a whole host of diseases. So these are some of the things that we're looking at.